Knee pain is very common in people older than 40 years of age. Why it is so? It is very important to understand that after the age of 40, our knee joint cartilage starts to get wear and tear, increases in the knee joint. In females, around the menopause, there are some hormonal changes, and also in males, after repetitive injuries, repetitive stress over the knee joints, there are wear and tear of the cartilage. It is also very important to understand कि हमारे knee joint पे 4 to 5 times हमारा body weight आता है, and as a result हमारा अगर 50 kgs का weight है तो हमारा 200 kgs का force हमारे knee joints पे आता है. Due to repetitive stress and repetitive injuries, this wear and tear increases, and after the age of 40, 45, 50, this knee pain starts to come in our life. It is important to understand कि knee pain अर्ली स्टेजेस में मेडिसिन और फिजियोथेरेपी से एक्सरसाइजेस से ठीक हो सकता है, बट इन लेटर स्टेजेस यू मस्ट सीक अ कंसल्टेशन बिकॉज दैट मे बी एन इंडिकेशन फॉर अ नी रिप्लेसमेंट सर्जरी.